Thank you so much for giving me your time today. I'm so excited about our conversation. I don't think there's anyone that has been more influential than you in the direction that KLPooch has taken. I don't think you're even aware of that. But if I can bring us back to 2012, which is when we met.
Yes.
I had just rescued a golden retriever mix called Leo.
Yes.
And he had been hit by a car.
Yeah.
And he required surgery.
Mm-hmm.
I heard through the rescue grapevine that acupuncture could be beneficial to his rehab. And so I brought Leo to see you. I remember the first question you asked me, which surprised me a little bit, was, what are you feeding him? And I very proudly said at the time, oh, we only feed our dogs premium. We feed Leo Black Hawk kibble mixed with tin food from Australia. You must have been rolling your eyes deep inside, but on the surface, you were very polite. You just nodded patiently. And then with the assistance of a whiteboard, you went on to explain how the correct food for mammals is the same as giving the right fuel or putting the right fuel into an engine. Mm-hmm. If you put the wrong fuel in, it doesn't go so well. Mm-hmm. And that if I was determined to rehab Leo the best I could, that it's important to address what he was intaking into his body.
Very much so. Yeah.
That same day, mm-hmm. I went back and all our rescue dogs were natural food. And that's not changed since 2012.
Never looked back.
Never looked back. Yeah. So I just wanted you to know that you have had an immense impact on not just the dogs back then, but since then we only had we had a handful of dogs. Yes. Now we've got over 250 dogs at our center.
Wow.
And you have changed the lives of hundreds and hundreds of these dogs over the past 14 years. So I just wanted
me very happy.
I just wanted you to know that.
Thank you.
When we first met, you were, I think I saw online that you were Southeast Asia's only TCM vet.
Yeah.
What does that mean? What does it mean to be a holistic vet versus a conventional vet?
A holistic vet is always not into patching up things, but actually it goes a bit into functional medicine, which is a fancy term for looking at root causes of diseases and of root causes to help heal. So this is basically a different approach. We look at every aspect of a patient's life. For any doctor, human or veterinarian, we look at symptoms and conventionally and patch it up. You have a red eye, I give you eye drops. You have a headache, take a Panadol. You have whatever, arthritis, there is a painkiller that you take then and then, and maybe then there is a supplement. That's about all. So it's always patching up. Whereas as a holistic vet, we look deeper. So there's a big difference. It's, in my opinion, faster and in some ways also easier to be a conventional vet because you patch up. You have your program, and that's what we are taught in university, our gold standards of treatments, and you follow that and you basically do that. So knee problem is a knee problem, a limp is a limp is a limp, so there's no difference. Whereas when you go into holistic medicine, every patient is their own unit, so to speak. It's very specific. Obviously, it's for us, our dogs are very unique to us, but also for us as holistic doctors. Your pet is very unique. So a knee problem is not always treated in the same way. A spine problem is not always treated in the same way. And traditional Chinese medicine puts even temperature types into and constitutional types onto pets.
Why did you choose this path instead of being a vet, just a traditional vet?
Yeah. I was very proud when I graduated at the University of Vienna in Austria, I was finally a part of this fraternity. I have to call it fraternity, it's quite patriarchal. And a certain disappointment set in when I found out pretty soon, like most of the vets do, we are not considered the best friends for our patients. They don't want to see us at all because we give injections. They can be painful. I mean, we do it always the best of intentions. But conventional veterinary medicine can be a painful experience, and is mostly. And it is a forceful experience. And because my animals are like my family, and I'm very adverse to being forced, I was like, somehow it doesn't feel right. But, you're a vet, and you do what you learned and what you graduated at. And then I had a major problem with my back. And it didn't go away with x-rays, all sorts of things. Everything is okay. I don't know why you're not good. So there was nothing to patch up from a conventional side, my back.
Can I just ask, was this when you were still a student or had you
No,
already graduated?
already
and
graduated,
practicing
worked-
as a traditional vet?
Yes, worked already for 10 years as a conventional vet.
Wow.
And then my backache set in. And it was bad. It was like partially I couldn't even walk upright, which was unpleasant to say the least, and partially also didn't help me to work. And so finally someone dragged me to an acupuncturist in Malaysia. And I was like, yeah, I learned some about acupuncture for animals in veterinary school, or rather in the university. It was mainly for horses and cows. And I was interested, but since I didn't practice for horses and cows, I kind of left this behind. I'm like, this is not going to work. What's acupuncture going to do? She dragged me, a friend, and she said, you start that now. It took me 3 months, or rather it took the acupuncturist 3 months of really regular treatments, which I never initially thought I would ever go through, but it made me instantly feel better. Not that the back pain disappeared. That was unfortunately not the case, but I felt better. I had this endorphin release. I felt cleaner. It is a thing between a massage, and the feeling afterwards, between a massage and some psychological cleansing. I just felt much better. People ask me, do you take a happy pill? I'm like, no. Why? I had acupuncture. And during all these acupuncture treatments, I thought, why don't we provide something like this as a supportive treatment, as a complementary treatment for pets?
Were you already practicing in Malaysia at that time? Your practice was
I
here?
was helping out the SPCA spay and neuter clinic in Kuala Lumpur. And I must say, always, I mean, surgery was never my favorite thing, but I mean, spaying and neutering, it was really for a good cause. It was this low-cost clinic so that everyone could afford it. And it was really an important thing. But I was always interested in internal medicine and talking with people, how to make their pet's life better, to share what I know. And of course, that didn't come at all into play. And maybe also the standing there induced this bad backache, because at the end of the day, I left this there. I couldn't do the work anymore. And then I didn't return back because I started my course, and then I practiced. I promised myself I practiced for a year just acupuncture to get really the hang of it. Because if you do it from the start on the side, it might fall backwards. And then from acupuncture, food therapy came in, Chinese herbal medicines came in, and then traditional European herbal medicines came in. So yeah, just never looked back.
Why did you choose to practice in Malaysia, not Austria?
Well, you asked me the same question my husband asked. My husband is Malaysian.
It's his fault.
Not at all. It's my fault that you didn't go to Austria, because he was more than ready, having studied and lived for quite a while in England. And he's very partial to the society structures there. He was ready to go to Austria, and until today, I'm not ready. Maybe one thing is, I have to say it's very shallow, but I really like the weather here. I am, from a traditional Chinese medical point of view, a cold person. A cold bitch, as some husbands
Never.
will call me.
Never.
And I thrive in warm weather. And I cherish every day the greenery, and I cherish the food, and I cherish the lifestyle. I love Austria, going back, visiting my family, but I'm really happy to come back here. Of course, also my family, my animals are here. But yeah, it's actually my fault. I choose to stay in Malaysia.
How many years of study would you say you've done all up, with the conventional medicine, plus the acupuncture, plus the traditional Chinese medicine?
So it's easy to count the years for conventional veterinary medicine. That was 5 years. Then I did another year for my doctorate. There's like between a PhD, but in Austria it's then called a doctorate. Then I did 2 years of acupuncture. So 5 years plus 1 year plus 2 years is 10 years. And ever since I I really veered into this naturopathic medicine, holistic medicine, traditional Chinese medicine. There's no end to study. I am also a member of the Royal College of Veterinary Medicine from the UK, and they require 35 hours per year on continuous education.
Upskilling.
Yes, and so I have to do that also. So these 35 hours per year are a must, and then beyond that, I do whatever I can to learn more and to be better and to be on top of things.
Let's start with the very foundations of health.
Yeah.
We are what we eat,
Very
and our
true.
pets are the same.
Yes.
What is biologically appropriate food for dogs?
It's actually very easy and very difficult. At the beginning, I found it difficult to find proper studies because we all know there are studies that are hailed to be the be all and end all. And give it 5 to 10 years later, it's like, no, that study it wasn't proper. So I had trouble initially to also find out where are my anchor points? What do I look at if I don't want to look just at studies that might, or their results might be challenged eventually? I look at nature. So basically, dogs, cats, also horses, but let's just talk about our carnivorous friends. They are not that far removed from their natural way of living, or at least their digestive system is not that far removed. Hence, we can really take the best cues that are never going to be outdated from nature, looking at nature. That's my basic guideline.
And when we look at nature, how can we break down into percentages what a dog should be eating?
Well, of course, there are studies, and there are, I would say, smarter people than me, both in Australia, Billinghurst, and there's so many names. They have done their studies, and I take this from them. But I also notice certain breeds, as we are here talking about breeds, are a little bit deviating from it. Like the really small breeds that I have a lot is Shih Tzus and Mini Schnauzers. They are a little bit different, and the Japanese breeds are also a bit different. But the average is 70 to 80% of proteins coming from animals, meat stuff. I don't want to call it only meat because it could be heart. In nutritional sense, heart is a meat, not an organ. Then, of course, out of this meat stuff should be about 10% organs, or not much more than 10%, maybe even below a little bit 10%, but it's a give and a take, as food is. And the rest should be vegetables. And you don't want to give always the same. At the end of the day, the biggest thing is variety is the spice of life. You don't want to get forever chicken breast, carrots, and broccoli. Even if the percentage is right, you give chicken breast 70%, carrots and broccoli some up to 30%. That's not good food. Because at the end of the day, food is more than just taking a part from a prey animal and then just feeding this day in, day out. That's where taste buds come in. I always tell people, taste buds prevent us from eating too much of the same thing. Our taste buds are, we can overpower taste buds with artificial food. That's, for example, processed food, or for us, it's like Twisties or stuff like that. You open a bag of Twisties, you can never eat only 3 of them. You eat always the whole package.
Okay.
But that's artificial food. Natural food, we do get oversatisfied if we eat too many apples. That's why we can't eat too many apples. We can't eat actually too many eggs. We can't eat, yes, we can eat too much chicken breast, but only because if we force it to our pets who have no voice, or they can't say, no, I want something else, I go to the supermarket and buy chicken drum, right? So we have to think a little bit. The most natural food would be raw, but for some people this is unfeasible. And for some pets, some cats, dogs mainly, we are talking, cats are picky. That's natural also. But for dogs, if they don't want to eat raw, they're usually not strong enough in their digestive system. Their gastric acids, for example, are low. Hypochlorhydria is a very common problem. But then it's cooked. It's also okay. As long as you cook it also with some mind, you don't deep fry things or boil everything, throw the boiling water away. That's a shame. But at the end of the day, it's all a lot of common sense with a certain guideline that's in the back of your mind. What are carnivores made of? So that's why I mentioned the breeds, smaller breeds, for example, like Shih Tzus and Mini Schnauzers, they are very, very happy to eat 60% of meats and 40% of veg. I found out through my years of practicing. Whereas many Japanese breeds, they really, really take, if at all, very little vegetables. And I feel because it's natural food, they kind of know their body better. So I tell owners, okay, cater to your dog. Try out things. Don't be too rigid. It's like my husband is Indian, Malaysian Indian, and every Malaysian Indian eats yogurt. No, my husband hated it from the start. And looking at him from a Chinese traditional medical perspective, yogurt is the worst for his body constitution. So I think taste buds do guide us what's good for us, unless we talk about processed food, right? Chocolate is not good for everyone, but I love it, So anyway, too much chocolate, let's put it this way. But generally, you just listen to your body, and you also help your dog find a way. When people get very nervous, how many eggs can my dog eat? Because she loves eggs. Like, you can't overfeed eggs, because there will be a time she won't be craving so much for eggs. There are certain nutrients inside in a package that are perfect for your dog at the moment. And that will change. So important is, that you don't get stuck with one recipe. That's why I did not take a degree in in veterinary nutrition, because I notice it's all about numbers and creating 1 or 2 recipes. Who is living like that? For me, it's like, I don't want to live like that. I can't live like that. I don't know anyone who can live off that. I mean, I love Pokeball, but you give me the same Pokeball for the rest of my life, I'm going to vomit, you know.
Become
I don't
a
want
Pokeball.
it. So why would we do that for a dog, right? Or including for a cat?
Can I go back on a couple of things
Yeah.
you said? The taste bud thing really fascinates me because I've noticed so many dogs are highly food motivated.
Yeah.
That they're so attracted to food
Yeah.
because of the olfactory
Yeah.
senses, I
Yes.
imagine, which are so much stronger than
Mhm.
ours. But when they eat the food, it's like it doesn't even touch the sides. Like I don't
Yeah.
even know if they taste it because they don't chew it. It's just in and it's swallowed and it's gone.
Yeah, and that comes from nature. Remember, we always go back to nature. They hunt in groups. So there is no dog, and plus their digestive system starts with the stomach. Our digestive system starts actually by chewing, because we have certain enzymes like amylase in our saliva. So if you chew long enough, we start to digest before it reaches the stomach. In dogs, have you ever seen a group of dogs? They find something or they hunt something and they all sit around, do a prayer, and I'm like, okay, let's not. No, if you're not fast, it's gone because the next one ate it. So for them, it's totally normal. That's why we say to people, don't wolf your food down. It comes from there. And dogs are not that far removed. So they are in, and here we digest.
But do they really then appreciate taste? That's my question. Like I know they appreciate different smells, but do they taste it?
I think the taste is more relating to what the body needs. That's my take on it. So it's like, that's why you can't overfeed eggs, but they like it. And suddenly they're like, you give them as many eggs as the first week after you change them to fresh food, and suddenly they're not an egg again or 2 eggs again. So it seems they are more in tune with how the body responds to food. And that's why certain things, like my own dog, you saw her, Ruby, she is not a fussy eater, but she really, really doesn't eat raw chicken or raw eggs. She's the first one who will not. And I noticed if she still gets some raw stuff. Initially, I didn't know also. I said, like, what's wrong with her? She starts to itch. So I know this. She itches when she eats raw. When she eats cooked chicken, very contrary to my dog before, who was exactly the opposite. So she can't take raw. That's why she doesn't like it. I would think it makes sense to listen to our pets, which is a bit hard with 250 dogs. I give you that. But for owners who have 1, 2, 3 dogs, I think it's possible to kind of appreciate that they are sentient living beings who are in some ways smarter than us, or at least they know their bodies better than we know their bodies. And we're not talking about processed food. Processed treats always go, but that's a different story altogether.
Yes. With the raw feeding, because we feed the majority of our dogs raw, I have noticed it's a very good indicator of how a dog is feeling.
Yeah.
If they one day refuse to eat the raw, I know something's up.
Yes.
Another good indicator is how they're healing from things.
Yeah.
So if they have gone off raw for a while and then we coax them with cooked food and the rest of it, once they have gotten over the illness, they'll start to eat the raw again.
Yes.
So for me, that's a very good sign.
That's very good. Yes.
I want to run the recipe of our raw food by you.
Yeah.
I suppose it is good because 60% of it is meat dust, which for people that don't reside in Malaysia, meat dust might be a bit confusing. So what it is, because we have a lot of frozen butchers here, it's the meat shavings that fall off when they carve the meat, and they put it aside in a box for us. So I suppose there's variance in that because it's all different meats that come in. So that's where the dogs get their variety.
Yeah.
So at the moment, we're doing 60% meat dust.
Yeah.
Then we do 10% chicken livers and hearts.
Excellent.
We grind up 10% chicken cubes, which include the bone. We have 10% veggies, which I know we could have more, but vegetables are very expensive.
Yes,
and
understand.
And then the last 10% we only added in within the year, and that is actually 10% of cooked rice, which I was very reluctant to do initially. I was trying to keep them grain-free. But I noticed that because our environment is a very highly stimulating environment, they needed the extra carbs to pad out a little the calories, the energy. And also it made their stool not so hard because of the bone content.
Yes.
So they pass motions a bit easier.
Yes.
What do you think of that sort of recipe?
Good. That's excellent. And you're very aware. And I think that the most important part is to know these meat shavings come in different, they have different ingredients each time. So you get the variety from that. The other percentages are really good. You really know your stuff.
Not too bad.
I didn't know I'm such a good teacher.
Oh, well.
No,
and I'm a good listener too.
Yes.
I told you make an impact.
Really, thank you. I'm happy to hear that.
How important are the vegetables, grains, and even fruit?
Well, how important? Everyone is different. So I just mentioned these small dogs really, really enjoy vegetables, fruits, as long as fruits are not too sweet or the sweetness in the fruits doesn't cause gas building.
But do they add value? Something like fruit, because
yes,
it does. It can.
But it doesn't add value nutritionally if you give them a stick of a piece of carrot and they just entertain themselves. There's nothing wrong with it, but nutritionally there is no value in it because pieces, as we know, dogs don't really chew. So they shave these things off. It gives them something to do. They can swallow it, no problem. But these pieces will come out the other end exactly the same.
That's why we blend our veg.
Exactly. And that's very important. You blend or you grate it really finely. Then you can give it raw because it's a really nice fiber. And of course, it feeds also the good bacteria. So the microbiome is stronger, and the microbiome is the gut brain. So it makes them happier. It makes them healthier overall. So from that perspective, vegetables are great. But you also have breeds, and I noticed it the Japanese breeds, Shiba Inus, for example, big population here of it. There are some, if you add more than 5%, they're like cats, if you add more than 5% veg, they just won't eat it. And then I think okay, then it seems, then you might add some fiber like psyllium husk or wheat bran, depending. And of course, if your dog or your dogs don't battle really major inflammatory inflammations, which I see mainly, then rice is completely fine. And actually not even inflammation-prone dogs would be always sensitive to rice, but some are. So I always tell people, if you have a lot of inflammation, first remove the carbs, that rain carbs. And even the very starch-rich vegetables like potato and sweet potato, and then little by little add it on. But for an overall keeping of dogs and for the bowel movement and for the calorie content and for the filling also, there's nothing wrong with rice or oats. Yeah.
Can dogs ever be healthy on a vegetarian or vegan diet?
From a nature point of view, I would say it's hard. But I do know, and I have had a client who come from India, and they told me there are communities who are vegetarian. Vegan, I have not really, we haven't really gone into that, but they told me they are vegetarian. These people know how to eat for themselves, vegetarian. And they have dogs and they feed them the same. And these dogs seem to do okay. So I think if you really know, because there are traditions and you really know a vegetarian lifestyle for a human, then maybe you also select out the dogs who are thriving with you, because if they cannot survive with you, they have to wander off to people who do eat meat or die. I don't know, but maybe it's also kind of a natural selection. Cats really can, because cats really, you malnourish them, they die. So that's really annoying.
With cats being such picky eaters, do you have any secrets on how to get them to eat raw?
Well, number one is cats are picky eaters by nature. Remember, dogs hunt in a group forever. They are first with the mother, and then, first the mother feeds them, but then the mother takes them out, then they're already in a group. They're always social animals. They're in a group. So a dog is by nature not picky because it wouldn't survive. It's like, we hunt this, we eat it. Everyone eats it. And if it's really bad, we vomit it out, right? And if it's just not stored properly, we vomit it out and eat it again. So that's dog's nature. And that's how they are. Cats live only for a certain time with their mothers. At a certain age, a young age, there's a window to it. They learn what is food. So if they get in this window only processed food with a certain taste profile, it's for a cat completely natural to think that is only food. That's why a picky cat is actually a normal cat. And that's why it's so important when we rescue cats, when we raise cats, to give them all sorts of foods. Like I just had a kitten picked up from a very busy road. Luckily, she survived that. And she just gets everything. She eats canned food once a week. She eats kibbles as a treat, and we only give that as a treat. She eats raw and she eats cooked. And she eats everything and different cans also. So she will never, because we got her when she was about 6 weeks old. She is now 5 months old. So she eats everything because that window, I can't tell you right now which window it is. I would have to look it up. But that's nature. The mother cat teaches the kitten, and then the kitten wanders off. They are not staying together usually. They can go their own way. So that's the problem. Why it's so difficult later on to make cats accept something else. But it is possible. I had a rescue cat from a shelter. And I mean, I have usually only rescue cats, but she came from a shelter. 30 other cats was delivered there from a hoarder. And so finally, I started to give them home-cooked food and raw food. It took 2 years to convince her that she eats cooked food, and there had to be 1 kibble on top of it. After the 2 years, I was fine. I was like, oh, thank God. Luckily, we had other cats who would eat her food. At the beginning, she wouldn't even the kibbles that were on the same plate as the cooked food. And there was only 1 teaspoon of cooked food, and the kibbles were aside. But it overall took 2 years. And then 1 kibble had to be on top. She didn't eat all that kibble and then the rest of the food.
Like a dressing.
Exactly. It had to be this way. 2 years. And eventually, because raw, I gave up. I was like, okay, this was so much work just with cooked food. I'm not going to go through all that. Never mind. She eats now cooked food. I'm already happy. And at one point, she starts to eat the raw food from the other cats. So eventually, their miracles are always possible.
Please tell me, Dr. S, it's now 2025.
Yeah.
Why are so many vets still adamant that commercially produced food, dry food and wet food, is the best food for dogs?
Do you want a nice answer or honest answer?
Honest, please, always.
Honest. It's because of pressure. It's pressure from a big industry behind it. And if you're not towing the line, that's why I also have to be a little bit careful. So I don't speak too much outside, as in public. If you're not towing the line, you're out. You are getting into real troubles. And the line is defined by an industry. We are not, until today, and I'm an old vet, so I graduated over 30 years ago. And you know how cars 30 years ago looked like and now, so there's a big difference. But what I learned 30 years ago plus, and what the people graduate now with, is exactly the same. Zero knowledge about food and nutrition. The only knowledge we get is basically a brainwashing session by big food companies that have ties to the universities.
That happens even today.
That happens today and everywhere. I'm not looking down on any country because I know it's worldwide exactly the same. So we pass an exam, nutrition exam, which is mainly getting numbers right, from crude protein for cat food to dog food and so on and so on. So it's all numbers. You have to regurgitate numbers, so you pass the exam. And then you are completely, as a student, left in the lurch because you know nothing about real food, because who can make anything out of numbers? And who should? Well, this is not about food. So here, the food companies come in. They invite students into a nice environment. They have really good speakers. They have all the studies, which are paid for, anyone can guess, and with the results that are favorable to anyone we can guess. And it's a nice outing for us veterinary students. We're not that spoiled by all sorts of invitations. And we get nice takeaways from an umbrella to whatever. And that's our education. And then we open a clinic, and the food companies again are here lending a helping hand, not necessarily totally without ulterior motives. And the rules that we also are left with when we graduate is that they're very strict. It is this food and nothing else. So there's so many factors that really rein us in.
I notice when I walk into a vet clinic, the shelves are sponsored by so-and-so.
Name it. Yes.
The pens, the notepads, the holders for the brochures, the gowns.
Yes.
That used to be the way with pharmaceutical companies and doctors.
Mm-hmm.
In Australia, at least, they've reined that in. So as a pharmaceutical company, you can no longer sponsor holidays or put up benefits.
Well, I would say officially you can't.
Not, yes. But still with dog food companies and vets, it's pretty blatant.
Exactly, yes, it is. And sometimes my husband says this jokingly, he says, you could earn so much more money if you were just a more normal vet. But we both joke about it because we take nutrition serious and we take it very seriously. What we are imparting, what I am imparting to pet owners. And I'm not into, of course, occasionally I go to McDonald's or whatever, everyone does, but it shouldn't be my daily food. How could I recommend that to my patients? And especially patients who come because they have multiple problems, because they have been treated before conventionally, and then there's nothing anymore to patch up. There's too many things to be patched up. So, yeah, it takes a certain stamina and a certain stubbornness, and maybe also being not very business savvy to kind of turn your back to it and say, no, I'm not going to do that. Also, to be a bit out of the eye and the focus of mainstream, because as soon as as the regulating organizations focus on you, you have to toe the line. You can lose your license if you're not towing the line.
Really?
Yes, absolutely.
By towing the line, do you mean they have to have a certain percentage of sales for this particular brand?
Not that.
Or?
No, but it's the food recommendations, and that's what they sell, what clinics sell. They are part of towing the line. So this is, you don't have to sell it, or there are the perks come in. If you sell a certain amount, you get sponsored from traveling to conferences, which is great, because if you have to fly, you will save a lot of money. To entry to the conferences, this is great. It is expensive. To even the stay, the hotel rooms are paid for you. So they're good perks, really. And yeah, you don't do it, it's your loss, huh? It's not my loss, it's my gain. I'm completely independent. I'm one of the very, very few, I would say. I don't really look around, but I can't blame my colleagues totally, because I know I come from the same thing. And being part of the herd is very much drummed into us from semester 1 onwards. So this is not an easy thing to break free. And it wasn't due to my free spirit. It was due to my backache that I had an idea, well, I want to explore something more. So it wasn't like a plan, I'm the big maverick and change everything. No, I am not. But so I know, I understand where others are standing and where they're coming from. It's a lot of pressure, a lot.
Brainwashing is evident in so many facets of education.
Mm-hmm.
And it's really hard to shake, as you say.
Yeah.
We have a fantastic conventional vet. And when we first used them, it was an uphill battle to convince them that all the illnesses he was treating did not stem from feeding our dogs natural food. And having been our vet now for 13, 14 years, he can witness for himself the aging, the graceful aging of our population. Yes, of course, we have just throughout the last year a flare-up of cancer, because our 80% of our population is now considered senior. We do have the odd chronic liver and kidney issue.
Yes.
The odd skin problem.
Yeah.
But comparative to the numbers we have, so many people come into our center and they just can't believe. They're like, your dogs look healthier than my dog at home.
Yeah.
Because look at what we're feeding them.
Yeah, you are what you eat and what you feed.
So there's no better case study really than an example like ours, where the lifespan of the dogs, you can see from some have been born at our center, and for the past 15 years they've been eating that raw food and are now still sustaining. Whenever I meet a new vet, once again the fight starts, and as soon as they hear that we feed raw, they're like, oh, well, bacteria and parasites and worms, and how do you store it? What would you say to these naysayers that say that raw food is unsafe because of the potential for bacteria, which is real if you don't store it properly, and parasites, worms, so on?
I usually don't discuss that with anyone. I think if you're really so concerned, and I'm a very lucky vet. The people who come to me are open for what we discuss. And so I'm not here to be like, to scare them into certain things. If you don't do what I'm telling you, this and this happens. But I also say, things have to be seen in context. Dogs, we all know, as much as we love them, they love to eat another one's vomit. And it's like, what the heck, I mean, and even some of my cats do that. And you would say cats are much more. No, also someone vomits, like, oh, it's nice, it's still good, let's whack it up. So much for bacteria, for grossness. Yes, you have to use always common sense, especially with fresh food. It's much easier than food that comes in a bag and basically has an indefinite shelf life. Because as much as there is a sell-by date, but we all know, even not being cooled ever, I always tell people, no cockroaches and no ants ever want to eat that food. It doesn't tell this a lot about the food. Whereas, of course, natural food will spoil. Yes, and we can have parasites, but that's why we have all these great deworming medicines, which I think once in a while is a good idea to deworm them. Yes, but you don't overdo all the pharmaceuticals for it. You use common sense. Of course, fresh food in the tropics, you have to have a good freezer. You have to do, you have to install diligent processes. You're doing all that. And about all these bacterial infections, toxoplasmosis, let's also know where this all comes from. Where does this come from implanted in our vet spray? Courses that are sponsored by pharmaceutical companies. I have to take these courses also because I need to get my points right per year. So I do take them because they're usually free of charge. And I'm a cheapskate and I don't earn extra money with the food companies. I'm like, okay, I take this course and listen to all that. But I'm removed a bit. So I'm not like, I moved away from what we learn. They tell you, you must do exactly how they tell you. And many of my colleagues are still in that kind of hamster wheel.
Are there some suitable alternatives that are commercially produced? For example, if a dog has intolerance to certain proteins,
Yeah.
is there ever a good reason to go commercial? Or should we always try, no matter, what sensitivities the dog has?
Mhm.
I think I know what you're going to say. Just make the effort to go natural every time.
I would think 70% of all my patients, 30% is old musculoskeletal, old patients, geriatric patients with musculoskeletal problems. 70% is skin problems with allergies. And partially defined food allergies, but more so allergies in general might be also involving environmental allergies. Allergy triggers. So firstly, food is not the enemy, be it commercial food or natural food. It's always an immune system that has gone haywire. An immune system that doesn't see friend or foe for what it is. Certain bacteria, certain virus might be a real problem for the immune system, a challenge. That's why we have an immune system. But be it chicken or be it peas, shouldn't be an enemy. So it's an immune system problem. But what we also know, if an immune system is already overreactive in a certain extent and underreactive somewhere else, what are the triggers? What are more triggers for this immune system to not calm down? Carbohydrates and chemicals. And this actually leads directly to packaged food will never. That's why these people come to me. They have tried all the processed foods, hypoallergenic, unallergenic. It didn't work. Because you can trick the body only so long, but you still always have carbohydrates and chemicals in this food. So the immune system will never calm down. So much for allergies, be it environmental allergies or food allergies.
All you have to do is look at the label of kibble, any example of kibble, even the highest costing kibble.
Yeah.
And the list of ingredients reads like an essay.
Yeah.
And what
many of the ingredients we don't even
I
understand.
don't even know what they are.
Yeah. How would the body understand these ingredients?
And what they teach us now is if you go to the grocery store and you look at the label and there's more than 4 ingredients, probably it's not good for you.
Very well said, yeah. So
we should eat whole foods.
Yeah.
We should eat real food.
Exactly.
But then when it comes to our pets, I just don't know why we can't.
It makes no
comprehend
sense.
it.
It makes no sense. But if you repeat a lie over and over again, it's supposed to become a truth.
Gastrointestinal food is the one that really gets me the most because it seems very oxymoronic to label a commercially produced and processed food gastrointestinal when the body has to work so hard to break that down.
Exactly.
Especially when it's in dry food form.
Yes.
Am I right?
You're totally right. Think also of kidney disease. Especially cats have this more. I mean, we are talking about dogs, but you have dry kidney disease food that's full of carbohydrates, that's really low in moisture, and that has protein in a small content, which is a protein that loads the kidneys with work. It's a complete, and then you give subcutaneous strips, but you feed dry food. It also happens to dogs, of course, but cats just more.
Mm.
It defeats any logic thinking. Any understanding of the body will tell you this is not right. Like what you say about the gastrointestinal prescription foods.
Wet food, any better?
Well, let me quote here Dr. Lisa Pearson. She's a cat vet and she's not a holistic vet, but she says it very succinctly. She puts it very succinctly. She says, the cheapest canned food is 100 times better than the most expensive kibble food. She talks about cats because cats are even more reliant on moisture in the food because their kidneys work differently. Their kidneys constantly, they're actually desert animals or dry climate animals. So their kidneys have always been designed to squeeze out the moisture from the food. Because in dry climates, you don't have a stream or lakes, you don't have really water. So the food must contain what the body needs. You give them dry food, you overstrain the kidneys all the time. So for that reason alone. But then the second is, in canned food, you have lesser carbohydrates, which is for cats, again, a no-no. Cats eat no carbohydrates in nature. Where is the carbohydrate? Have you ever seen a cat going into a rice field and chewing or digging up potatoes? It's just not happening, right? Until today, right? So you're absolutely right. You have to use common sense. And I must tell you, Shannon, that clients that come to me from all walks of life, they have the same thought processes of you, and they're just not willing to just go for it for whatever fairy tale you're told or story you're told, going completely against their understanding because they love their pets and they do. We are more educated now about food, and they're like, this makes no sense. So you're not alone. But many pet owners also tell me, I cannot talk to my vet about food because I get nothing back and I'm becoming the enemy. So it's a bad situation to be in for the pets.
Before you were talking about the pets lacking the digestive enzymes to tolerate raw food. With some of our dogs that are aging, this does happen. Does cooked food cook the nutrients out? Because I have heard that it's more nutritious.
It depends very much how you cook it. And there are many people who don't think much. That's where my education comes in. And maybe that's also a good thing for everyone to think about it. You can cook food to death. My husband, who is, a chef patron, he knows much more about cooking than me. So I give also raw food because I totally cannot cook. That's was at the beginning an aspect. But cooking food, you can cook food to death. A curry, he says, is kind of the protein content, the nutritional content, aside from the spices in Indian curries, that's very low because you overcook the food. Because you use, even in some Malay foods, you use very tough cuts. And you have to cook them until they're soft.
So pressure cooking actually is not very nutritious.
It's not great, but you got to do what you got to do if you have a lot of dogs. Also boiling and then throwing away the boiling water because a lot of nutrients go actually into that boiling water and you throw it away. When people say they want to boil it, I usually recommend boil it with little water and use that water to rehydrate then the food, and then it's okay. So, of course, the more careful, the best would be steaming. It's like the typical flash cooking of Chinese food, which is usually keeping all the nutrients in. So, yes, it can make a difference. But overall, you will always, with whatever cooking method you use, have more nutrients in it than in processed foods. That's for sure.
Some owners might want to keep a bag of kibble just on hand for when they're busy, they don't have time to prepare.
Yeah. Just like we go to McDonald's sometimes, no?
Yeah.
No
and
problem.
for ourselves, because we don't have the budget to feed
of course
dogs who are sensitive to raw food, a completely cooked food diet that is individually suited, we do have kibble as a base and then mixed.
There is no 100% of 100%, but that's why no pet needs to be 100% on kibble. That's why at times we don't have the luxury of giving 100% fresh food.
If our circumstances call for using a commercially produced food, what can I look for on the label? Like, are they all equally terrible?
I would say the lesser ingredients and the more you understand the ingredients, the better the food. And it has nothing to do with the price. If you notice a lot of ingredients, you mentioned it before, a lot. And
they all have so many though.
And the more, there is one brand now in Malaysia.
Okay.
And they seem to do a better job. I'm just not 100% sure. Is it because maybe the regulations here are not so strict, they don't have to at all? Pets like it. I have had only one client who said, no, my dogs really don't like it and they vomited it out. But all the others seems to have a really accountable number of ingredients. And well, I always say, well, maybe you'll give this a try. And they seem
I'll have
do
to get the
well.
name from
Yeah.
you afterwards. In Australia, not so much here. I don't know why, but in Australia they do a lot of the dog rolls, like a big sausage looking
Yes, in
roll,
Europe also.
and you cut them. I don't
Yeah.
here. I can't seem to find them. But what do you
Shannon,
think?
that is
A new business idea. Let's do it, Doctor.
Let's do it.
New venture.
We do it together. Just keep me out from cooking because no one will eat what I
I'll
cook.
ask Shankar to do
I'll
it.
give you
What's your opinion about those?
I think that's a great option to have, like in between fresh food. I mean, it's possibly if you eat this day in, day out, maybe not a great idea, but that's the same for other dry processed food that doesn't even taste great. But why not integrate these things as well?
Not a bad option.
And another thing, Shannon, maybe you just think about it. I give this always to people as well. For example, what we do for Ruby in Penang, I regularly forget to defrost because my helper is not there. But in Penang, I have to defrost for Ruby breakfast. So she gets now, as a rule, at least once when she comes over the weekend with me to Penang, scrambled eggs with a bit of yogurt. And if that's defrosted, a bit of our pre-made vegetable mix. And it's a great food. It's cheap. The yogurt I have usually for me. The eggs we have anyway. So she gets 2 scrambled eggs and with a bit of coconut oil, and her personal chef is doing that. So
I would eat that.
It's great.
Yeah.
I usually ask Shankar, can you make another one for me? It tastes really good. It's a cheap meal and it's really nutritious. There's nothing wrong with it. It tickles the taste buds. Yes, the dogs will lick it down right away, but why not give something that tastes good and is healthy and is cheap? So, I mean, for such a number that you have, but maybe as if someone is sick, you might want to start with, why doesn't this dog get some scrambled eggs or soft-boiled eggs or even hard-boiled eggs? It doesn't really matter. We just scramble it with a bit of coconut oil or ghee or butter, unsalted butter, just a little bit, and some yogurt at the end so it's not completely cooked. So, and they love it. And a bit of vegetable if you have. If you don't have, then you skip it this time. Easy. Easy and very healthy.
Nice. Talking about what is natural for a dog, in the wild, a dog would never eat every day.
That's another thing, yes. Yeah.
I'm a huge proponent of fasting for humans.
Yes.
And I don't think it's unhealthy for a dog to fast
It's
either.
Not, unless it's a pregnant
Yes.
dog. We all know that.
Special
it's a puppy in
circumstances.
development, a dog who is not well, and
Yes.
a very old dog who might not be able to digest.
Yes.
We know that. That's also
Yeah.
common sense. I'm totally with you.
So generally we feed our dogs once a
Yeah.
day,
Yes.
apart from those special cases
Yeah.
like you mentioned.
Yes.
They need a bit more extra weight, smaller meals more
Yes.
frequently.
Yeah.
Would you say that it's the best practice?
I would say it depends. You see, for many dogs who are not having a high stimulating environment like yours, they are alone at home. For them, food is just an occasion. It also shows my pet parent is doing something for me. Yeah, of course you can give twice a day. And for some really old ones, especially I have really, really old patients, small dogs, they have a malfunction of the insulin, the pancreas where the insulin is produced. They often need actually a supper. And sometimes even they wake up. So it depends. But I mean, these are not healthy dogs. I also have to say that. But it goes with, you work with what you can do. In your setup, with once a day, that's perfect. Because that's also, and with the fasting, it's perfect.
What are some general supplements that you would recommend for dogs?
Well, number one is always the right food. And then supplementing depends very much on the condition. There can be good supplements out there for joint and joint health, with green lip muscles, with a whole range. There are good products out there. And they might really make a positive difference with the cartilage they contain and all that. So that feeds good joints. Otherwise, probiotics, if you can't give homemade or store-bought fermented stuff, which is mainly yogurt and kefir, because sauerkraut and all that, not all dogs like, which would be very good. Sauerkraut is excellent. Given in Europe quite regularly, seems dogs accept it there more. But fermented foods with live bacteria, that's a really good thing. Or probiotic supplements.
We use rosehip.
Nice. Okay,
for
that's great.
arthritis, and we find
Yes, that's really good. Yeah. I know there are some good Australian products with rosehip. Yeah, that's good also, yeah.
One of the major criticisms of feeding dogs raw that we've had is a tartar builder on the teeth. And you can tell me whether or not this is factually accurate, that because of the wetness of the raw, stays in between the teeth. And then if you don't regularly give your dogs,
Toothbrushing and all that.
or because a lot of our dogs, they live or they coexist in group kennels.
Yeah.
Impossible for us to feed a bone.
Yes, you would get
know,
real fights. Yeah.
Is that a real thing, the threat of tooth decay with raw feeding?
No, it's the opposite. You get decay because of the makeup of the bacteria in the mouth. And all of us have everywhere bacteria. And luckily, we have many more good bacteria than bad ones. So same thing is in the mouth. If you have more good bacteria than bad ones, your teeth will and your gums will stay healthy. And some people and some dogs are blessed. They have genetically, it's like with people, they eat all sorts of rubbish. They barely brush their teeth, but they have really great teeth. So a certain genetic component is there. But the other thing is, what do we feed which bacteria? The bad bacteria in our mouth, as in many other parts of our body, intestinally, love carbohydrates. So the more carbohydrates you give, the more you feed bad bacteria. And they are the ones who cause plaque and then gingivitis. So it's kibbles which contain at least 50% carbohydrates in all forms. Doesn't matter whether they come from grains or not. They do feed bad bacteria. And that's why the industry is huge to clean teeth. You can look into every veterinary clinic. 90% of their patients who need regular tooth cleaning are fed kibbles, not raw food.
So once again, the dental biscuits are
That's a complete
lie.
It's a complete ruse. Yeah, it's a marketing game. Just repeat it often enough and people will believe it. But I remember I was cut short when I, in my time as a conventional vet, trying to ask a medical food representative, how do kibbles keep teeth clean? Because there's no answer. There was a company that coated the kibbles, or there is a company still existing, but they had to take the food from the market. They coated the kibbles with something that kept the teeth clean, but it ruined the kidneys because that chemical, that substance was not safe. But ever since, kibbles, as they are not keeping anyone's teeth clean, especially with that myth fairy tale in the best sense or in the worst sense. Kibbles are so abrasive. They cut off the. We have seen when dogs eat kibbles, they inhale them. No one is like. And by the way, I ask my clients that also. Have you ever had cleaner teeth after eating a cookie? Well, if you have teeth like me, not exactly all. I have to ask my husband, still from the cookie something in between? This is you just use common sense. You know what's the deal. These other things are all marketing things. Clever, smart, repeated often enough, but don't believe that.
See, this is how I know vegetables are actually bad for me.
Yeah.
Because whenever I eat salad, it gets stuck in my teeth. No issues with me.
Whereas chocolate never gets.
That's how body's telling us, isn't it?
It's the body tells us everything.
For those people that don't have hundreds of dogs, and it's quite safe to give your dog a raw bone, or is it tripe the other thing that's good for dental health? What would you?
I was thinking anything that needs to be chewed is a good thing. So of course, some people even give them some contoy which is like smeared with maybe some unsweetened peanut butter, whatever. Anything a dog. That's why the carrots in itself, that can be a great tool also if a dog likes it. My dog doesn't looks at me and at the rabbit and like the carrot is actually not for me. But all the things that are to be chewed are good.
To activate the saliva?
Also, for the mechanical action, saliva, lots of components in. And a certain meditative state, they all go into their own spheres when they are chewing. Yeah? So anything that keeps them chewing and is not kind of breaking off is good for them.
Once again, the proof is in the pudding for us, in that over the past decade and a half, feeding all our dogs raw. Do you know how many dogs we've actually had to send for tooth extraction? 1.
Oh, what?
A single one.
See, the proof is in the pudding.
Yes. Apart from nutritional advice, clients come to you for alternative medications.
Yeah.
Clearly, there are things that should not be replaced. For example, antibiotics, organ function medications, perhaps?
Very few. I
Very
think
few?
they're out there.
Okay, once again, with the marketing, it's hard to know.
Yeah.
Could you give us an example of what you would replace with a natural medicine or a herbal medicine compared to what a conventional vet would prescribe? Because once again, we work with fantastic vets, but I get a little worried when our animals are discharged and there are 5 different packets of medications.
Conventional medicines are here to patch up symptoms, to allow the patient to live through and heal. Ideally, that's the ideal thing. So you have uncontrollable bleeding, of course, you suture or you give also a certain medication that stops that. But of course, that's not for long run. Chinese herbal medicines, they are like a whole formula. There are several components, very carefully selected. And the guinea pigs were people over hundreds, if not thousands of years, which is a great thing also. Finally, it's not a poor beagle in a cage, but it was humans who tried it on themselves and sensei's who refined it. So for spinal problems, spinal inflammation, spinal pain due to inflammation, squeezed nerves, intervertebral disease, it is called wonderful. You don't need steroids, the analgesic drugs, the painkiller drugs, can leave them aside. At the very beginning, I'm always all for it. Go and have a diagnostic workup with your conventional vet. And of course, the vet will prescribe a painkiller and an anti-inflammatory, a drug. But then how long can you keep that up? And so then we come in with something that can actually substitute. So for maintenance and also healing off a longer drawn process like spinal problems can take like 2 to 3 weeks to heal off. You don't want to give. And also my colleagues usually don't like prescribing painkillers because they can be very hard on kidneys and liver. Even so, the newer types are all praised as being, but we all know, I'm an old vet, I always know after 5 to 10 years, we all know there is no drug that doesn't have only good effect, that doesn't have side effects besides good effect. Then even for antibiotic, as you mentioned them, I use, but I'm here very picky where this comes from, human grade colloidal silver, which works really well for ears, for the skin. It really works well because it works against bad bacteria, but it doesn't affect good bacteria. There is something like this out there. Then certain probiotic sprays you can use for helping the skin to heal. You don't need all these antibiotic sprays for healing. You often need probiotic sprays for healing the skin because it's actually, instead of always killing, you want to nurture good bacteria. We actually have more good than bad bacteria. We shouldn't equate bacteria with being bad. Actually, more of them are good. Drugs are great and we are grateful to have them. And conventional medicine is great to have for acute problems. But what I'm dealing here with, and that's why acute problems cannot come to me. That's why we are by appointment only. You need conventional medicine to save a life. That is, I'm not going to stick a few needles in and hope for the best. But for chronic diseases, for diseases that don't help, that are not helped by medical drugs anymore because the suppressant just doesn't work anymore, there we have alternatives. And they are really without side effects. So you cannot treat everything with alternative medicine, with naturopathic medicine, but you also obviously cannot treat everything with conventional medicine. So you need to know always what's the best for the patient.
This may be a little controversial in this country, but CBD for pets. I've been fortunate enough to try it in Australia.
Yeah.
It works wonders.
It does, yeah.
I had a 17-year-old cat who started having seizures.
Yeah.
And over 36 hours, little seizures, just non-stop. Gave him CBD. He was in a coma, probably stoned out of his mind for 6 hours. I kept having to poke him going, are you alive? And then when he came out of his CBD coma, he didn't have a seizure after that.
That's wonderful.
At all.
Yeah, CBD, I'm a big fan. But the problem is we can't prescribe it here.
Yes.
And I do know my colleagues who are conventional vets, are very interested in it. So we can't do much. We can only say, well, we are not against it. And then the owner does what the owner does.
Yes. I know it's a tricky thing to talk about here. Now, where does the acupuncture come in? Because I know you said your personal experience motivated you to venture into this path for animals as well, because you wanted to give them the same relief.
Yeah.
There are so many varying theories on how acupuncture actually does work. if you talk particularly to someone from a Western background about things like chi,
it's like,
we're like, what is
you lose
that
them.
even?
Yes.
Is that a science? Does it really exist? Other people think that it's got something to do with the nerve stimulation that clearly does work in some way.
Yeah.
And then some people would say it's a placebo effect. I would argue that perhaps that would ring true if it was a human patient, but for animals, there's no such thing as placebo. They don't know what is supposed to work or what
That's great.
doesn't work.
Very smart. My business advisor and better half, Shankar, told me to start right away when I graduated. He said, you start with giving acupuncture to shelter animals because there is no owner who believes in it. And then he said, you will see if you get effects because that's like the ring of fire you jump through. So how did I see? They brought to me musculoskeletal challenge rescue dogs, or dogs that, they possibly had been hit by a car, not in such a bad way that they were terribly debilitated, but they had a limp. They couldn't stretch. You saw, and they had good caretakers who knew these dogs. And they all became better. I think we're not here to convince anyone with this study or that study. You give it a try. What you will see is the following. It has anti-inflammatory properties. And what you can see right away, because after an acupuncture treatment, the bladder will be human or the horses, I'm not so sure, I didn't do enough horses, but humans or pet patients, cats, dogs, even rabbits, they always make a bigger pee puddle after acupuncture than usual. So you can really tell there is a detox effect alone from the urine quantity. And then they are totally relaxed. I mean, in humans, you can say, that's placebo. You want it to work, so you're very relaxed, And before I did acupuncture, I always thought first you poke someone. Of course, when you take out these nasty needles, of course, you're relaxed, more relaxed then. But actually, it is, you can see in pets how well they finally sleep, how well they suddenly sleep on the back, which they haven't done in a long time. So these are the immediate effects.
You used to treat my quadriplegic dog Tyson.
Yes,
numerous times,
Yeah.
and he would always be so relaxed after a session with you. It was so good to see him at peace and in some relief. You called this point at the back of his skull, I think, the happiness.
That's the one here.
Oh, is it here?
Ridge. There's a ridge. It's actually, you can find it in every dog quite easily, even in cats. There is like a V ridge of a ridge of bones, which is like a V shape. Right. In some it's more in front, in some it's more higher. And it's always the tip point inside the V. That's the GV20, governing vessel 20. That's a happy point that lifts up the chi.
All dogs love that.
Yes, and that's why good nurses, good caretakers always will, aside from some chin rubs, they also many times like it. But this one is actually rubbing an energy point. It's a cheap an acupuncture point. It's called governing vessel 20. That's that one. So this ridge is in some quite in front. It depends on dog and breed. In some, you just always look for that V, and the point is exactly there. It's quite easy to find.
How were all these points designated? Is it just through centuries of, same with humans, centuries of experimentation?
Quite interesting. It's a bit different in small animals. You see, we have a long history for large animals in Chinese written acupuncture history, because oxen, which was possibly just male cows, and horses were a war equipment. So, of course, you need to win your wars, you need to kind of have a good equipment, right? So we have really old traditional notes for that. But in dogs and cats, and also rabbits then, and even exotics, it was actually a group of American vets who visited together with Nixon in the 70s, early 70s, China, and saw, so it was for a cultural exchange finally, right? And the vets saw how cows, for example, can be operated without any anesthesia, just with electroacupuncture. They stand, they eat, and you open their rumen and operate. And they were like, what? How the heck is that? Yeah, you can do that. And feel nothing. They eat, they stand and eat, so they if they are in pain, they would not. Without any restrictions. So they are just tied up. Obviously, they don't walk around. But they have electroacupuncture. So electroacupuncture is a very, very strong stimulation at very specific points, overpowers the pain sensation. And so you can open that up. And they were like, how? So these vets then got together, visited back and forth, and they formed the association I'm a member of and I graduated with, International Veterinary Acupuncture Society, a very unfancy name, International Veterinary Acupuncture Society. And they then said, okay, we need to learn more. But the thing is, with small animals, there was not much. There was basically very little, if anything. So they then started to work with human acupuncturists and transferred then the points, they gave them also names that are not only Chinese names, Mandarin names, which is great if you speak Chinese because they have all the names mean something. But if you don't speak it, it's really hard to remember those names. So they now standardized together with human acupuncturists, of course, as well, the channels, the meridians. So you have large intestine and small intestine, and you have the points are very specifically located. And then they checked out how is that also working for a cat and for a dog? For the same thing, like this is the master point for head and face, large intestine 4. I cannot tell you right now the Chinese name, forgot about it. And yeah, they found out, when you have toothache, you can use that. It's a pretty unpleasant point to be needled, but it does help. So, and they checked all this. So it actually, small animal acupuncture comes from humans.
How common is it for pets to struggle with the needles or to have a violent reaction?
Violent reaction, actually not. My biggest thing is and I have this luckily very rarely, if people come in with pets and they don't have really a relationship with each other, there is a certain trust deficit. And then putting needles in, they don't even trust their owner. So how would they trust me? So that can be a struggle, but luckily that's very rare. For most pets, especially those who didn't have recent painful experience on the table, they're completely fine. For some, they are nervous, especially those who had many treatments on tables and injections, because although the needle is really, really very fine, but there's a little poke like a mosquito bite, they still think it's an injection to be followed, and that can be unpleasant. But within 2 to 3 treatments at the most, they are okay.
Most of us are aware of the general signs to look for to assess a dog's health.
Yeah.
The pinkness of the gums.
Yes.
The clear eyes.
Yes.
The moist nose.
Yes. Yeah.
If they're dehydrated, we do the skin pinch test to check for that. Are there other signs that you would look for as a baseline?
Yeah, for tongue color. Tongue color can tell you a lot. The shape, I don't want to go too much into the shape. It goes quite detailed into organ diagnostics in traditional Chinese medicine. But the tongue color can tell you a lot, especially when the pet is relaxed. If you just come home from a walk with your dog, the tongue color will be dark pink. But if a pet is relaxed and you see this lavender bluish color, you really, really need to consider checking out the cardiovascular system, right? Or a really pale tongue is definitely something you're like, okay, we might deal here with an anemia. Let's get this checked. Also, cardiovascular system. Or tongue that is always very dark purple, disregarding resting or running, means we do have a certain heatiness, inflammation usually inside the body. Or a tongue that's really weird, like has certain crevices, breaks in between. You might not know what this means, but get your pet checked out, especially a blood test result, because it can mean that they have depending where these lines are. Also, for example, gastrointestinal tract problem, gallbladder problem, liver problem. Sometimes, of course, liver problems might also show in some jaundice. But at the beginning stages, you might not see jaundice. You just see the tongue looks really strange. So tongue shape, not so much shape, but like how the tongue looks, the body, and also the color can tell you a lot.
What about a tongue that is excessively shriveled or retracted?
It's also not good. That means, that's here. My diagnosis is usually a Qi deficiency, not enough energy. So there's something wrong. That is really worth to dig deeper and find out what it is with whoever you go, whichever vet, conventional or holistic.
When I checked your website, I saw you've really expanded your service. You've now got a clinic in Penang.
In Penang, yes.
Do you actually travel there
every week?
Every week?
Every week. I leave early
3
on Sunday
hours?
morning. 3.5 hours. So early Sunday mornings before 7 o'clock. Have a quick coffee and chat with my husband, who then ventures off into his restaurant for his supper do. And then my day starts until 7 in the evening, 8 usually.
So you do a week there and a week here?
So no, Sunday, Monday, Tuesday I'm in Penang. And Wednesday to Saturday I'm in KL.
So see, I saw that on your website, but I was like, surely she can't do that roster, surely.
There are some crazy people.
Surely she must mean that she's been in Penang for a week and
No.
that. No.
Half week, 3 days and 4 days. Yes.
What?
Yes.
Wow.
I had a big problem when I started opening the clinic in Penang. All of them thought I'm closing down in KL and going now to Penang. And you can't leave us because there's no one else who is doing exactly what I'm doing, right? Which is a lovely pressure, but it is a pressure, no? Even when I go on vacation, people go, you're coming back. I'm like, of course, I'm not moving. I'm going
Please
on
don't
vacation.
jinx me. I definitely am coming back.
Yes, I plan so. So yeah, so Penang is our center. So it's quite an interesting thing. This is very established. I'm 17 years now in KL, and Penang is now 3 years. So in September it will be 3 years. And Penang is because the northern states have a lot of dogs, especially the island of Penang is very, very pet friendly, dog friendly, also more so than other places in Malaysia. And I know there was a huge interest and a huge and there is an excitement that you get alternative treatments as well.
Being a holistic vet, you of course prescribe a change of the entire lifestyle rather than, as we've mentioned, just putting a band-aid over the symptoms.
Yeah.
What have you found owners to be most resistant to or most reluctant to change?
Exercise. That's usually a big issue. And like making floors less slippery, which is a big problem. You can't just tell an owner you have to line your whole house with yoga mats. It's well meant. It comes from a good place because a sliding dog with neck problems or spine problems or other musculoskeletal problems is for sure not a happy dog. But the other thing is exercising. Many people underestimate the value of regular exercise and not just, yes, it's important to sniff, sniff, but just the sniff, sniff, walk, walk, sniff, sniff, walk, walk is not enough. It is a sniff, sniff, and then a certain stretch should be an uninterrupted walk, basically to strengthen the muscles that stretch from the neck to the tail end. They're kind of the back core muscles. And that with sniff, sniff, walk, walk, only as my physiotherapist calls it, the shopping walk, is not enough. So people underestimate. I have to bring that up again and again. I feel sometimes like a news judge.
Well, that doesn't surprise me because people are reluctant to exercise for themselves.
Yeah. Well,
that's
true.
Now there are several choices of TCM vets. There are acupuncture courses offered from different institutions. I've seen those as well online.
From Chi Institute, yes. Yeah,
from now you can become fully qualified after 143 contact hours. What's your opinion on that? Is it a good thing or a bad thing for Malaysia?
But generally speaking, I think it's a good thing. But I also think it gives a new challenge to the pet owning, pet loving, pet parenting community, which is basically finding those vets who are really good in this specialist field. See, I can now open a dental practice for pets. I might not be a veterinary dentist because, yes, I have done the course and I kind of know, obviously, I know the configuration of teeth, but if I do this only peripherally on the side, I may not know. Firstly, I will not be that good because my practice is lacking. I do so many other things, and also my understanding might not be exactly there because this is not my focus of interest. So, for acupuncture, for patching up some pain conditions, is a pretty simple thing. You do cookbook acupuncture. It's basically you learn about points and points combinations, and you just use them. So it's basically a knee problem is a knee problem is a knee problem. It's like there's not going to be, you just have this recipe of point choices and you do it. So as long as you don't poke any organs or blood vessels, it should be fine. But whether this really goes into helping your pet feel truly well and become better and healthier is another question, because at the end of the day, you're still prescribing processed food. You're not addressing anything of the lifestyle. You also don't have the time because you squeeze that in as another income stream, basically. So for pet owners, it's now the task to distinguish who I need for what.
What sets the Asia Paws mission apart?
Basically treating every patient and pet owner like I want to be treated with, I want my pet to be treated and want to be treated myself. So this is something I am very, very I'm very, very strict about. It needs to be welcoming, it needs to be structured. And that's the reason why we have appointments that have to be booked online. So you're not depending on when the clinic is open and how well you converse with a clinic admin person. No, you book yourself. So you come here, you don't have to wait. If you wait longer than 15 minutes, your treatment will not be charged. It's as simple as that. That keeps me on track as well. You won't have bad smells. You won't have nasty noises around that stress out your pet. The treatment is done in privacy, and the doctor really attends. The doctor is in that case me, but also all the other health professionals. They really attend to you and your pet. See, you might have 250 plus pets, but when you come, yes, of course, then I understand certain feeding practices is not possible. But when you come with a sick pet, I will tell you what I think is the best, and we will discuss that. So it's a team effort. I want this to be a team effort. I'm not here to tell you I know everything, you know nothing. Don't tell me what food it is. But I will share with you what I think, what the food you give can do and can't do. And then we work with the pet also. If a pet, I had this very rarely, a pet is totally averse to acupuncture. Cats can, because when they're in a lot of pain, they don't want to be poked. For them, it's like a claw comes in. Then we do laser acupuncture treatments, which is very specific laser stimulation of acupuncture points. But it's always, you are unique. You and your pet are unique. And that is what is the overarching theme of Asia Paws in any location that we have, and with anyone who works with me.
I love that. I love that.
You. You're so good for my English. You're such a kind person. I'm going with my extra broad shoulders.
As long as the head can still fit out the door after. It's okay, we're good. Doc, you've always been so financially generous with us. You treated our animals pro bono. You come to our events for fundraising and not charge anything and donated all the proceeds. And yours is a tent that the line goes, stretches for miles and miles. And, you're just working the whole time. It's been incredible. It's impossible for me to overstate what you've given us in terms of your guidance, your advice, and the direction you've set KLPR on.
Thank you.
I just can't thank you enough.
Well, it's my pleasure, and I can't overstate how much you do for dogs who really deserve a chance, a good life, because there is second to none to KLPR. I can vouch for that, and I congratulate you, and you're really in awe of you, and you're my inspiration. And what I give to you is basically giving back to all the people and all the dogs who don't have the luxury of having a private owner. And my clients know with part of their money, we fund that, and they're happy with that. I don't take money from corporations. I only use what I work for, basically. And here we budget, and I can help. I'm so happy to help. For me, this is not for me a business. It is a calling. And I have a certain age now. I am at a certain age where you have to be realistic. My cousin just died a year ago. He was not healthy, but he was always pretty well. But I know he and me, we lived a life. When it's ending, I look back and I don't have to say, I should have done this. I should have done something different. I'm like, I have to live every day in a way that makes me feel I did my best. And I did as I could, what I was put here on earth to. Hopefully I fulfilled it. At least I tried my best. And that's basically, I think, that's the secret to keep on going, to keep on doing. I think that's the same as you. It's like you have that calling, like, I am here to do that. That is, I wasn't planning it. I wasn't planning to become a holistic vet. I was, as I said, I was so proud being the big vet, telling everyone, no, I give this injection and do the surgery. But no, my path, yours for sure. I'm not sure whether you came really from Australia to Malaysia to set up a hugely successful, partially or for many disabled pets, rescue place that is like paradise for them. And it's really great and inspires so many people. But it is what we do. We do it with our heart, and that keeps us going.
Absolutely. We were called to it. There's no other word for it.
That's true, yeah.
I wish you every success in the world
Thank
for
you.
continuing to inspire and change people's mindsets. May we continue to fight the good fight for many decades to come.
Thank you.
Thank you so much, Doc.
Thank you.
Thank you, everyone, for watching. I look forward to seeing you next time.